For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the digital health transformation agenda, which are very, very important pillars in achieving universal health care coverage. Through Taifa Care, we want to ensure that every Kenyan can access health care without financial hardship. The integration of the Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Chronic and Critical Fund is reshaping the health financing landscape in our country because it is inclusive and because it is responsive. The Social Health Authority, which is very central to this transformation, has of today registered 24.7 million Kenyans. They have already enrolled that number. And out of these, over 6 million Kenyans have underwent through the mean testing with an average contribution of 590. That is why the governor is paying close to 40,000 for her Social Health Authority Insurance Fund. That's why I'm paying over 35,000. And that is why Mama Mboga, when she goes through the mean testing, average is 590. So our commitment to make sure that healthcare is accessible, is equitable, and is affordable has come to pass. And this is a very clear sign of public trust in the system. Nakuru County, as of today, has registered 840,386, constituting 39% of the population. So we still have huge numbers to cover in Nakuru County. We have only covered, those who have registered are only 39%. And only a fraction of the registered households have paid their premiums. A lot of people have asked us, how do the informal sector, the salaried people, their contribution is paid by the employer? How do Mama Mboga, how do the people in the informal sector, how do they pay the annual premium if they don't have the money? We have said it, Lipa Sha Pole Pole initiative has brought affordability and flexibility. And I want to tell the people of Kenya, every day between 8,000 to 10,000 Kenyans in the informal sector pay their annual premium. The Lipa Sha Pole Pole is a very progressive because it tells you if you are to pay, for example, and this I need to make it clear, if after you go through the mean testing and you are told your annual monthly premium is 300, you multiply by 12, it comes to 3,600. Then you pay 4 months in advance. Then the balance, you are told, do you want to pay weekly, monthly, or daily? And last night you could see in our system, there are Kenyans who went through that system, and daily they are paying 10 shillings, 15 shillings. And at the end of the day, the system will tell you, pay. If you don't pay that day, the next day you'll pay double, 20 shillings. And we have seen that the healthcare system in Nakuru is up and running. It is something that many other people should borrow from. Let me come to the National Equipment Support Program, because we want to make sure, this government wants to make sure, for universal health care to succeed, we must have drugs in every facility. For universal health care, Taifa Care to succeed, we must have the right equipment in our health facilities. And in this program of the National Equipment Support Program, which is transforming access to care. And this equipment, let me make it very clear, it is not bought by the national government, it's not bought by the county government, it is bought by the suppliers, it is fee for service. They are the ones who will take care of those facilities, those equipments. The number of Kenyans who use that facility, SHA will reimburse those equipment owners. So there's no investment. And Governor, I am very happy to report that Nakuru County, will in the next 2 weeks realize the impact of the National Equipment Support Program. The following equipments will be installed in the month of the first week, from the first week of August. In Annex Hospital, we are going to install a mammogram, dialysis machines, and orthopedic machines. In Bondeni Sub-County Hospital, a specialized laboratory service equipment will be installed. In Molo Sub-County Hospital, digital X-ray, CT scan, routine laboratory service equipments, and all others that are required, that have requested, will be installed. The same for Bahati, CT scan, and general theater services. For Karingate, they have all that, digital X-ray, Langalanga Sub-County, Subukia Sub-County, Orongroni Sub-County, Njoro Sub-County, Maimahiu Level 3. All these sub-county hospitals will receive the latest equipment. This intervention will bridge the critical gap and expand equitable. As we move forward, let us recognize that health is not just about systems. It's about trust, it's about dignity, and it's about community. And that's why the dignity of the patient is of paramount importance. Going forward, the patient is the boss, not the facility, not the healthcare worker, not the leadership. And that's why we have introduced, and this is very clear, we have introduced in the last 3 weeks something called bed capacity access code. No Kenyan, no health facility, be it public, private, faith-based, will be allowed to operate outside their bed capacity, given to them by the regulator who is here, Dr. Kariuki. When you apply for a license, you must say how many beds do you need. If you said 50, you will admit 50 patients. No more Kenyans sleeping on the floor. No more Kenyans sharing beds. Kenyans who don't know each other, they have different ailments. And if you tell us, oh, they are Kenyans, we can't return them, from Nairobi, from my office, the office of the PS, from our people here, the digital CEO, the SHA CEO, we will call the governor and we have told her this morning, this is how the bed capacities are. All your hospitals have enough beds, empty.